48 hours. I read it all like a hawk. Where are you reading? The newspaper. Yeah, I've already voted. I cannot be influenced now. I got my. You know the problem. No voting pamphlet came to our house or our neighbors. So the county said, go down to the post office and ask. None were there. True. And so they mailed it. We got it day before yesterday. I got my ballot yesterday. I mailed it back yesterday. It went out in the afternoon mail. Oh, you gotta believe. You can't influence me. Stop by the post office here. Woo! Mary, where are you, Mary? So I don't know if that's voting suppression.
Mary, you gotta start with the right thing.
Oh, I believe it.
That's
I
only
did.
one
I
time.
did. But the post office didn't have them. That's what the county put. Go to the post office. They didn't have them there either. Ask the post office.
Okay, Wes.
It's an imperfect world.
It certainly is.
Welcome to our Vote for Health rally.
Bienvenidos a Voten por Nuestra Salud. Bienvenidos aquí con nosotros.
It's a beautiful October day in Medford,
Es un
Oregon.
muy lindo día de octubre aquí en Medford, Oregon.
We've had a very difficult year with the pandemic,
Hemos tenido un año muy difícil con la pandemia,
economic downturn, and the
con
fires.
la economía que va hacia abajo y más aparte los fuegos.
We've had a lot to worry about
Hemos tenido mucho de qué preocuparnos
and a lot to protest against.
y mucho de qué protestar.
Today we have something to vote for.
Y hoy tenemos algo para votar en favor.
I am Lori Hoagland.
Yo soy Lori
Hers. This is Angelica
y ella
Valtierra,
es Angélica Valtierra,
the interpreter.
nuestra intérprete.
And I am here from Healthcare for All Oregon.
Y yo estoy aquí para All Care for
All Oregon.
All Oregon.
And it's an organization that had its 20th anniversary this month.
Es una organización que tuvo su 20 aniversario este mes.
We have been completely committed
Hemos estado completamente
to
comprometidos
actualizing healthcare as a human right.
a
Yay!
tener,
I like that phrase.
el derecho de obtener salud. Tell her she doesn't have to speak for me. That's okay.
And what we mean by this is birth to death care, care for all
Estamos luchando para que todos tengan derecho a
races,
salud. Y lo que eso significa es de que queremos que todas las personas,
and also
de que todas
Yes,
las
I
personas
want
que
it!
tengan
Yes, I want it! Yes, I want it!
care
que
for
puedan
all
obtener
economic and medical conditions.
que puedan obtener beneficios de salud para cualquier clase o cualquier
Your
nivel
speaker doesn't
social,
The speaker is not on.
aunque tengan cualquier
Okay,
tipo
yeah.
de salud, de condición de salud.
And we have membership all over the state of Oregon.
Tenemos miembros por todo el estado de Oregon.
We have a task force right now
Tenemos un
that's
equipo
in the
ahorita que
process
está en el proceso
of developing
de
a program
desarrollar un
for
programa
Oregon.
para Oregon.
We recommend that you
Recomendamos
sign up
que ustedes se inscriban
and join us in this
y
campaign.
se junten con nosotros para esta campaña.
You can put your phone to our QR code, which will take you to the
Puede
website.
poner su teléfono y agarrar nuestro código para meterse a nuestro website.
Joining us means that you will get a newsletter every month, and
Unirse con nosotros significa que va a obtener una carta cada mes
you will get an opportunity to have input in the development of this program.
Esta carta le va a decir lo que estamos haciendo y usted va a tener la oportunidad de darnos su opinión en este programa.
We want everybody on board.
Queremos que todos estén en el mismo paso.
The task force is a patient-centered group,
El equipo que tenemos,
and they will be making recommendations to the legislature in 2021.
el equipo que tenemos es un equipo que se reúne para mirar más que nada por el bienestar de los pacientes y queremos ver un éxito para el año 2021.
On a personal note, I am here in total support of Measure 110.
En la nota personal, yo estoy aquí totalmente apoyando a la medida 110.
I am the voice for my patients.
Yo soy la voz de mis pacientes.
I work on the La Clinical Mobile Unit
Yo trabajo en la clínica, en la unidad movible.
and take care of patients struggling with addiction every day.
Y proveo cuidado a los pacientes que están teniendo problemas de adicción cada día.
I see people struggling with withdrawal symptoms when they're trying to recover on their own.
Me toca ver cómo mis pacientes sufren de esos síntomas de dejar la adicción todos los días.
I see people who are released from jail into a community of users waiting too long to get their appointment with recovery services.
Y veo a mis pacientes salir después de salir de la cárcel, después de un arresto, llegando otra vez a su comunidad de adicción, porque tienen que esperar demasiado para que los puedan ver y les den el servicio de recuperación que necesitan.
We are 48 out of 50 states with our ability to provide recovery services.
Somos el número 48 de 50 estados que tiene una tasa muy baja en proveer los servicios de recuperación que necesitamos.
Statistics show 1 in 10 Oregonians struggle with some form of addiction.
Las estadísticas enseñan que 1 de cada 10 oregonianos está sufriendo y está lidiando con un tipo de adicción.
We need to do better.
Necesitamos hacer esto mejor.
We will be able to expand our services with Measure 110.
Y vamos a poder extender nuestros servicios con esta medida 1.10.
And I'm now going to turn over, I'm Lori Hoagland,
Yo soy Lori Hoagland y ahora
and I'm now going to turn the megaphone over to Anna Ford
le voy a pasar el micrófono a Ana Ford
to give us some details
para
about
que ella
Measure
nos dé
110.
los detalles de la medida.
Put your mouth right on it. It's not sure that even helps.
You can have the microphone, it'll be easier for you. Oh, okay. All right. Hi. Muy bien. Hola.
I'm Anna Ford with Unite Oregon.
Yo soy Ana Ford con United Oregon.
I'm here to talk about why we should vote yes on Measure 110.
Estoy aquí para hablar por qué debemos de votar sí en la medida 1.10.
If there's one thing that the fires have taught us,
Si hay una cosa que estos juegos nos han enseñado,
it's that we need access to local services,
es que necesitamos tener acceso a los servicios locales,
whether that's water,
ya que sea agua,
food,
comida
housing,
o casa,
or healthcare.
o también servicios de salud.
Right now,
Ahorita.
1 in 11 Americans is addicted to drugs.
Ahorita 1 de cada 11 americanos están adictos a cualquier tipo de droga.
1 to 2 Oregonians die every day.
1 de 2 oregonianos muere cada día.
Rogue Valley has 2 treatment centers.
El Rock Valley tiene 2 centros de servicios para adicción.
If you self-select into one of these centers,
Si usted lo eligen para que pueda entrar a uno de estos centros,
it's a 3-month, 6-month, 1-year wait.
es a 3 meses, 6 meses o hasta 1 año de espera.
People are trying to circumvent the wait
Las personas están tratando, ¿verdad?, de encontrar una entrada
to get priority to health care
para encontrar una prioridad a los servicios de salud,
by going through the jail system.
entrando al sistema de la cárcel.
This is a problem.
Este es un problema.
This is a problem because if you go through treatment
Este es
after
un
going
problema.
through prosecution and getting a possession felony,
Este es un problema porque si usted va después de ir a la cárcel a un centro de tratamiento,
after you do the work of treatment,
después de que hace el trabajo del tratamiento,
it is difficult or almost impossible
es muy difícil o casi imposible
to get housing and a job.
que pueda obtener una casa o un trabajo.
If you can't get housing and a job,
Si usted no puede obtener una casa o un trabajo,
you fall out of society.
usted se cae, usted más que nada se pierde en nuestra sociedad
You fall into isolation.
y se queda usted aislado.
Isolation is the conditions for addiction.
Y la isolación es una condición que te trae a la adicción.
Making jail the prerequisite for health care
Haciendo que la cárcel sea una de las opciones que te pueda ayudar a obtener los servicios de salud.
creates the cycle of addiction.
Eso es lo que crea el ciclo de adicción.
Measure 110
La medida 1.10
allows people, Measure 110
la medida 1.10
makes it possible
hace posible
for people to self-select
que las
and
personas
get treatment.
puedan seleccionar dónde obtener su servicio de recuperación.
This makes it possible
Esto lo hace posible
for people after treatment
para que las personas después de su tratamiento
to get housing,
que puedan obtener su casa,
job placement,
que puedan obtener un trabajo
and go back to being a self-sufficient person.
y que puedan seguir siendo una persona que se mantiene por sí misma.
Measure 110
La medida 1.10
allows the person to heal and come back to society.
le permite a la persona que se recupere y que vuelva a su sociedad.
It allows healthcare workers
Le permite a los trabajadores de salud
to help people with addiction directly.
ayudarle directamente a las personas con adicción
It empowers the whole system.
y le da poder a todo el sistema.
Person who needs healthcare
La persona que necesita,
and person who gives
la
healthcare.
persona que necesita la ayuda de salud y la persona que está dando esa ayuda de salud.
Measure 110
La medida 1.10
makes sure
se asegura
that people recover.
de que las personas se recuperen.
Thank you.
Gracias.
Woo! All right, thank you.
Thank you, yeah.
Hello everyone, hola.
Hola a
My name is
todos.
Virginia Canderas.
Yo soy
I am the
Virginia
regional
Canderas.
director for Unite Oregon.
La
My pronouns are she and her. Unite Oregon is a statewide organization with 4 chapters. Unite Oregon es una organización estatal con 4 capítulos. We are led by people of color, immigrants, refugees, working families that are experiencing poverty. Esta organización está hecha por inmigrantes, refugiados y personas de familia que están experimentando pobreza. Unite Oregon supports 110 because they will provide programs for people in our community that have addictions and mental health issues. Unite Oregon apoya la medida 110 porque va a proveer programas para las personas de nuestra comunidad que tienen adicción y problemas mentales. Throughout our country, people of color and immigrants face discrimination with our criminal justice system. They are being arrested for low-level drug offenses, which has a negative impact for the rest of their lives. A través de nuestro país, tenemos gente de color y inmigrantes que estamos en frente de discriminación en la justicia criminal aquí en este país. Estamos arrestados por ofensas bien bajas de drogas y ha sido un efecto bien negativo que impacta a nuestra comunidad y a los seres que viven en esta comunidad. Criminal records prevent them from applying for housing, pursuing education, and getting jobs. Estos récords criminales nos pone atrás en agarrar casas, en agarrar más educación y agarrar más trabajo. ¿Esto es justo? No! Is it just? Is it fair? No! So vote yes on measure 110. Vota sí a la medida 110. Yeah, United Oregon supports it and we will win, right?
Woo!
Yeah. Thank you.
Sí se puede.
Sí se puede.
Sí se puede. Sí se puede. Sí se puede.
Yes, we will. Yes, we
betcha,
can.
sister.
Yes, we can.
Woo!
Yes, 110.
if I step back, I think nobody has trouble hearing me. Stop me if you've heard this joke before. We've got a beautiful plan. It's so beautiful. We're going to repeal and replace on day one. Can we all agree that's not funny? It was a lie in 2016. It's a lie now. Had their plan passed, 300,000 people just in the 2nd District would have lost their health care, and millions of Americans. But many of you standing here today made sure that wasn't going to happen. For months, you rallied just a block away. You made your voices heard.
Greg.
And now, you're going to win. Thank you. Thank you so much. Thank you to each and every one of you. Thank you to ORG Indivisible. Thank you to Unite Oregon. Woo! Thank you to Healthcare for All Oregon. Okay. And thank you to Terry Martin, soon to be our newest county commissioner.
Yeah, that's right.
Hello. My name is Alberto Enriquez. President Trump, Representative Greg Walden, you tried to kill our affordable health care. Prepare to leave office. I'm the Democratic and Independent candidate for Oregon House District 6, Medford.
That's right.
Let me tell you a story. I'm a child refugee. I saw my parents struggle with poverty, and I've seen what the right help at the right time can mean. It means the world. 5 of my parents' children completed college degrees. 3 served honorably in the military. Today, the 2nd generation is exceeding all my parents' dreams. Our own 2 children graduated from Swarthmore and Harvard. My parents worked hard. They died too young, and they didn't see those joyous graduations. But I'm happy to say this over and over again. Thank you, Medford Public Schools. Sí se puede.
Sí se puede.
Yes, we can. That's what I hope for every child in Medford. Let them rise up, study, be healthy, rise.
Yeah.
Sarah and I have lived in Medford for 32 years. For 12 of those years, I was a reporter for the Mail Tribune. What a job. It took me in and out of all the schools, courtrooms, county and city meetings, to fire and accident scenes, county fairs, school bands on parade. I got an eyeful. I saw a town crying out for basic needs, housing, living wage jobs, and yes, especially affordable health care. Even after I left reporting, I'd occasionally get calls from mothers seeking help for their children. Sometimes I could help. Often the answer was our public health clinics like La Clinica.
Yeah.
But even they had no dental services. Today, they do. I'd like to celebrate our successes, things that all of us here accomplished together. I wish Rich Rohde were here. He's a wonderful man, a social justice champion.
Oh, yeah.
And he first talked to me a dozen years ago about healthcare as a human right, and it seemed like a dream. We joined together with Healthcare for America. Thank you. We fought for the Oregon Health Plan. We fought for the Affordable Care Act. We were confronted with disgusting lies about death panels and our candidates' birth. But you here today and you online carried the fight. You and millions of others like you, small business owners and medical professionals who lobbied alongside me in Washington, D.C., folks who couldn't get insurance at any price, emergency room workers who lost patients who got care only when they were at death's door, women who paid up their medical plans for years, but as soon as they got breast cancer, they were non-renewed. Countless folks bankrupted by medical bills and lifetime caps on coverage. Even as insurers enjoyed a unique exemption from antitrust legislation and profiteered shamelessly. But you won. And today, all over Oregon, all over Medford, you see the results. 30% of Medford residents are covered by the Oregon Health Plan. They're getting the preventative care they need to live healthy lives. Every dollar we put into the Oregon Health Plan brings in $9 in federal matching funds. Who in their right minds would not trade dimes for dollars all day long? Every dollar we put into the Oregon Health Plan brings in $9 in federal matching funds. So who wouldn't go for that deal? I'll tell you who. When she was running for office 2 years ago, my opponent, Kim Wallen, publicly lamented the supposedly high cost of the Oregon Health Plan. Taking care of our people doesn't cost. It's an investment. It pays dividends. We've seen our regional medical center boom. That's meant construction jobs. Asante is now Jackson County's largest employer. And for every professional our hospitals and clinics hire, another 2 or 3 jobs are created in our community. What's good for people is good for Medford.
Okay.
It's all right, we can hear you.
I'll wait.
I wouldn't. Please.
That's not where, let's go.
Keep talking about health care. We like that.
Let's hurry so we can chant. You can chant him out. Hurry up.
Health care for all. 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 Health care for all.
But we have to look closely at what Measure 110 would do. Measure 110 would have the Oregon Health Authority appoint an 18-member committee that would then set up voluntary assessment facilities around the state. How many people think drug addicts and drug abusers would voluntarily go to a clinic to assess whether they have an addiction?
Me, I do. I definitely do. I definitely know. And it's really hard to find those places because there's not many of them there.
That's right. We need more.
Wait till it's your turn.
I'm going to continue speaking.
Well,
Thank you.
It's your turn to talk.
Not only that.
You're being rude.
No
You
one
can get your chance. You want
false
your chance.
promises.
Hey, you want your chance?
Impact dangerous to you.
Get out of here. You want your chance?
110 is not about treatment.
No.
110 is not about compassion. Vote no on Measure 110. There is a perception that this is compassion, but
Healthcare is a human right. 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 Healthcare is a human right.
Yeah!
Por darnos la ayuda como gente de nuestra comunidad que estamos ayudando. Y no hemos podido proveer la ayuda que necesitamos porque no tenemos los servicios adecuados. Así que por favor vengan y voten sí en 1-10. Sí vamos a poder proveer servicios para toda nuestra comunidad. ¿Qué necesitamos?
Healthcare!
Healthcare.
Now!
Necesitamos ahorita.
Thank you.